So our research is not the first to find that women who are attracted to or have sexual relationships with individuals of more than one gender might be particularly at risk for poor health outcomes. And there's quite a lot of research suggesting that bisexual and other non-monosexual women are at high risk for mental health and other health problems. But we don't have a lot of information that helps us understand why that might be or what it is about being a non-monosexual woman, so someone who's attracted to individuals of more than one sex or gender. We don't know what it is about that experience that might explain these health outcomes. So one of the goals of our research was to try to answer this question and understand more about this diverse group of women that we in our study are calling invisible sexual minority women. So for this piece of work I'm going to talk about now, we're trying to identify any characteristics of these women that might differentiate them from one another and from other women that might help to explain their high rates of health problems. So as the first step in this analysis, we have spent a lot of time looking at our interviews with the 29 invisible sexual minority women who participated in the qualitative arm of the study in order to look for important differences and similarities in their experiences. And through doing this, we've identified 9 characteristics that we think might be important to understanding their health experiences. So I'm just going to briefly go through those 9 characteristics. The first one is how they self-identify their sexual orientation. So within our invisible sexual minority group, we have women who identify as bisexual, who identify as queer, but we also have women who identify as heterosexual or other labels like heteroflexible or bicurious. And so we think that these different identities might be relevant to their health experiences. The second characteristic is women's sexual and relationship histories. So we see in our group of women that there is a large group who are mostly involved with men and have had only a few or only sexual relationships with women. We have a group of women who have been involved with men and women about equally. And then we have a smaller group of women who have primarily been involved with other women and have had only their current male partner or only 1 or 2 male partners. So we're interested in understanding whether these different relationship trajectories might be relevant to understanding their health experiences. The third characteristic we're looking at is how important their same-sex experiences or their sexual minority identity is to their sense of self. For some women, they see this as a core part of their identity or who they are, and for other women, they don't see it as a significant part of their identity. Another characteristic we're looking at is women's current partner's support for their sexual identity or sexual history. Many women in our study describe their current partners as being very supportive. Others describe their partner being entirely neutral about their sexual identity or sexual history. And then a few women described their partners feeling uncomfortable or threatened by their history of relationships with other women. We're also looking at the length of women's current primary relationships. Some women are in very long-term relationships and others are with a newer partner, and we are interested in whether that might have an impact on their health experiences in the transition to parenthood. We're also looking at the age at which they had a first same-sex attraction or experience. So for some women, they were attracted to other women when they were very young and recognized early on that they were bisexual or otherwise attracted to women. And then for some, their first relationships or attraction to women happened at a much later age. We're also very interested in how open women are about their sexual identity or sexual history with other people in their lives. For some women, everyone in their lives that's important to them knows about their history of relationships with women, and for others, it's something that they keep very private or they don't see as being relevant to other people, and we're interested in whether that degree of openness might somehow be relevant to their health experiences. We're also looking at whether our participants can imagine themselves having same-sex relationships again in the future. For many women, they imagine that if for some reason their current relationship ended, they would imagine themselves potentially being involved with women again, and then for others, they don't see it as something that's going to be part of their future. And then the final characteristic we're looking at is whether they consider themselves to be part of or they want to be part of an LGBT community. And here again, there's a lot of variability from women who feel very connected to the community to women who don't see that community as something that's relevant or important to them. And we do know from other research that community support can be very important in mental health for sexual minority people, so we want to look closely at that variable. So the next step in our analysis will be to use these characteristics with our survey data to see whether they are associated with mental health in our invisible sexual minority women, and also whether they can help us identify different subgroups of invisible sexual minority women. Altogether, what we're hoping to do is understand better what specific characteristics of non-monosexual women might put them at risk for poor mental health outcomes, so that we can target interventions to address those factors and ultimately improve mental health for this group.